Where the physical activity levels associated with narrower of the intervertebral disc space height and more high fat content in the multifidus muscle, not in the erector spinae, and pain is increasing more and more, and disability also prolonging more. So this is the result and conclusion they find out. How they have done this research, what are all the grades and what are all the methods they have been done this wonderful research, that we have to ruled out. We can see intervertebral discs 117, for example, mm to 0.08 mm depending on the age, gender, has been ruled out as a normal average. And body mass index, high fat content, all this can be ruled out through the muscles. And body mass index, as we know, very anthropometric measurement like height, weight can be measured. And intensity of the pain scale, how this has been measured, we know visual analog scale, 0 to 10 centimeter scale, 0 no pain, 1 2 3 mild pain, 4 5 6 moderate, 7 8 9 severe, 10 extreme. So this has been found out with disability levels. They can able to do little amount of activity, they can able to do more vigorous activities, but they are not doing sedentary lifestyles. So this has been ruled out in the disability scale. So this is called as a chronic pain grade scales. So both physically as well as psychologically also this disability can be analyzed. Catastrophic fear, not doing any basic works, work absenteeism to the workplaces, and treatment failures, keep on going, taking medicines, seeing different doctors, physiotherapists, not getting rid of back pain, taking so much of rest because of the contextual factors advice, society, nearby person, or doctor advice, physiotherapist advice, taking more amount of rest, completely become lazy, not doing any activities, and keeping a lumbosacral braces support called as LS belt. So these type of a thing which implicates the physical inactivity. So this maybe increases more and more anxiety and depression. So very important thing. So once we get a pain, suddenly the important factor which activates in the body is anxiety. So this study finally investigated the physical inactivity is associated with all the above problems. What are all the problems? Disc heights, fat content, pain, and disability. So now we can just see in brief about disc height, how they will be reduced. Average disc height was calculated by summing up from L1 to L5 S1 vertebra. The intervertebral disc divided by the height divided by 5. So for example, I have told already 1.17 mm to 0.08 mm. So has been calculated from L1, L2, L3, L4, L5, S1 divided by 5. Finally, they find out there is the remarkable differences in the height, high fat content. There are different grades to assess the fat content in the muscles, paraspinal muscles. This can be taken through the MRI by T2 axial images. Slices, according to that, they have taken an MRI. Grade 0, no fat. Grade 1, 0 to 10% fat. And grade 2, automatically what will happen? 11 to 50% fat. And grade 3, more than 50% fat. So high fat content, it's greater 50% present in the multifidus muscle, not in the erector spinae. So this confirmed. Next, body mass index, height 0.17 centimeters measured by stadiometer, weight 0.1 kg weighing weigh machine. So this can be calculated by height weight, according to that BME calculated. Body mass index, chronic pain scale questionnaire. Complex consists of 7 questions. on pain and disability. Grades of scaling disability, low back pain. Scoring grade 0, no pain. Grade 4, high disability, high pain intensity with limitation of the work. So this is the grading of 7 questions in chronic pain scale questionnaire. So these are all different types of assessment tools. Physical activity level analysis, how they can be done. The physical activity level can be analyzed, how it can be done. Questionnaire. The questionnaire which contains, for example, moderate walking, brisk walking, jogging, swimming, table tennis or tennis playing, all these things which can be considered as a activity, physical activity. How this physical activity can be categorized: 0 to 14 days, 1 to 8 days, 9 to 14 days, 0, inactive. So like that they have been categorized. So totally they have taken as a 2 weeks, 0 to 14 days. The 1 to 8 days consider as physically moderately active, and 9 to 14 days consider as physically more active, 0 consider as inactive. So this is the categorization they have been done for physical activity. Finally, the results of the study shows body mass index 68% of females were obese. They are in 29.2 kilogram weight. So obesity is the main important reason for physical inactivity. Physical activity, 21% of participants are inactive. Among 100 percentage, they have been find out the 75 adults already have been selected in the samples. 21 percentage of participants are inactive. 53 percentage are moderately physically active, and 26 percentage are high levels of physical activity, regular exercise doer, jogging, walking, yoga doing, or weight training, all the types of activities, high level physical activities, 26 percentage. Among them, the 21 percentage of physically inactive peoples, what happens? Intervertebral disc height was narrower of 10.2 mm. Rest of the peoples, you can see the height is 10.6 for moderately active and highly physical active 11.8. So 10.2 is the narrower. So this confirms that intervertebral disc height, which is reduced in sedentary behavior peoples, physically inactive peoples. High fat content of the multifidus muscle, not in the erector spinae. In that you can see inactive 60 percentage of the fat content, moderately active 34 percentage, physical activity levels very active 15.8. So each activity levels having a fat content, but it is more in the inactive peoples. Next, increased high intensity of the pain level. It is in 7, 8, 9 and 10 scores, and disability levels also 10 scores. So this reflects that physically inactive, which is directly having a link to structural changes, that is a height changes in intervertebral discs and muscle properties like high fat content in multifidus muscle and increased pain, hyperalgesia, which is also present, and which is prolonging to chronic disability. So forced immobility is the main reason. Already there was a research which was found out on 2013. Prolonged immobilization leads to cross-sectional areas muscle wasting. Now physically inactive proved to be lot of changes happens both bodily and pain, as well as the disability, psychosocial behaviors changes. So take home message: the lower physical activity directly linked to low back pain and disability. So what is our, as a physiotherapist, we must encourage the patients to more and more active. That is very important. At least moderate physical activity per day, 20 to 30 minutes. which avoids such type of problems like height, muscle content, as well as pain and disability. To prevent all those things, we have to encourage them more and more physical activity rather than inactivity. That is an important thing that I wanted to implicate here. Next, what is physical inactivity? So we have to know that inactivity is very important thing. It what happens in the body, it deconditions the body totally, especially the muscles weaken and loss of muscle bulk, biceps, triceps, lower limb, thigh muscles weakness and bulk which is reduced. And what will happens in the body, breathing difficulty occurs due to the muscular weakness. And what all the other changes takes place in the physiological system. Physiological changes like non-communicable diseases like type 2 diabetes, cardiovascular diseases, obesity, colon cancer, anxiety and depression double the risk. So what is, as a physiotherapist, we must encourage all the persons to do at least moderate physical activity per day, 20 to 30 minutes. It is very, very essential to prevent all those complications. So as a physiotherapist and as well as the doctors, respective doctors who are listening this video, and public friends also listening this video, please watch patiently and feedback me in your free time. And if you like this video, subscribe this channel. Thank you.